My name is Elpidoforos Soteriadis. I'm an occupational medicine physician and an epidemiologist. I studied medicine at the University of Athens Medical School, and after that I moved to the United States of America, where I studied epidemiology at the Harvard School of Public Health, as well as I did my doctoral degree in environmental health with a concentration in occupational health, also at the Harvard School of Public Health. For the past 15 years, I've been working as an occupational medicine physician and epidemiologist with working experience in Greece, Cyprus, and the United Arab Emirates. And I have been working as a researcher in the field of epidemiology and infectious diseases for so many years. Vaccines have been used in the past few decades quite successfully to help us control different epidemics or lower the spread of in particular microorganisms in the general population. There are useful tools in our fight against pathogenic microorganisms. However, these new vaccines that have been developed for coronavirus are using new technology that has not been previously used in the past. Therefore, we need to be quite careful with this new technology, especially and particularly due to the fact that this new technology involves the use of genetic material such as RNA or DNA from coronavirus. There are very few scientific publications at this moment that give us information about the safety and effectiveness of these new vaccines. However, we need additional information in order to be able to assess the benefit and the potential risks of these new vaccines for the general population. This is a very interesting question with respect to vaccinations. It used to be in the past that we thought we needed to reach a rate of vaccinations of about 60 or 70% of the total population in order to achieve what is called herd immunity, meaning that we have such a high population in that has been vaccinated, and through this high population, high percentage, we reach a stage where even people who are not vaccinated have some protection from their compatriots. But however, those studies were too old and were based on specific algorithms, mathematical algorithms that were assigning possibility of transmission equal to every individual, which by no means this is true, because probability of transmission for certain individuals is higher in the general population, for certain individuals is much lower, and therefore there are some new scientific publications now, new research studies, indicating that we may reach herd immunity even with percentage of 25 or 30% in the general population. Therefore, we don't know exactly how coronavirus will behave in the general population when vaccines are introduced. It remains to be seen whether old mathematical algorithms or new scientific approaches better simulate the situation of the spread of the virus in the presence of vaccinated people. Vaccination should not be mandatory for so many reasons, including respect of human rights, respect of individual dignity, respect of medical guidelines, respect of specific legislation and regulations, and in respect of Universal Declaration of Human Rights. We have not had any mandatory vaccinations in the past, and I don't think that we can tolerate any mandatory vaccinations in the present or future. No, I haven't received any official response for my letter. To be honest, I was not expecting any official answer from the president. My goal and objective was not to receive any answer from the government. My goal for publishing this open letter to the president was to share my ideas and recommendations in order for everyone to be able to use these recommendations in the best possible way, including the government of Cyprus. Coronavirus is not that dangerous as it has been propagated in the main media of our country. I think that numbers tell the truth, and this is why I have dug into these statistics in order to find out what's going on exactly with the fatalities in the general population, in order to be able to share this information with the general public. And I'm really happy that fatalities in 2020 appear to be a little lower than 2019 or the past 3 previous years. I think this is an indication that in Cyprus we have not had any major negative consequences from this epidemic, and that we should continue taking wise and focused measures. My involvement in the public arena with respect to this epidemic is based on my great love for my country and the people of my country. And I'm trying my best to share my knowledge and experience in this field in order to help as many people as possible to get away with this disease with the least possible consequences. I will be happy to collaborate with anyone and provide my suggestions and recommendations on a voluntary basis to my country.